COVID-19 has a huge impact on the polio education program in the African region because, as you know, we have to practice the social distancing. And when you're talking about vaccinating children, it means having contact with the children and their caregivers. So this poses a very big risk for us, to the volunteers, the vaccinators, and the communities, because conducting these activities may spread the COVID-19. So based on that, most of the activities have been postponed until maybe later in the year when you see how the situation evolves. The polio program has the biggest footprint in terms of personnel, as well as expertise in assisting other programs to control other outbreaks beyond polio. So we're using our staff really to assist in things which we know they're very good at, surveillance, which is very, very important, planning for any of these responses, contact tracing, and as well as other activities which may assist us to identify other cases very, very quickly. So the WHO recommendation and guideline is, because of the social distancing, is for us to postpone and suspend these activities. The governments are looking at the risks of COVID, the opportunity of conducting some activities. But at the end of the day, the final decision has to be made by the countries themselves, the governments themselves. But our advice for now is to postpone these activities to avoid further spread of this COVID-19. It's been more than 3 years now since we had our last wild poliovirus case in the African region. Surveillance has improved, and we have already received documentation of polio-free status from 43 countries which have been accepted by the African Region Certification Commission. So we're planning to hold a meeting with this commission to look at the final documentation in Kampala, but that has been postponed because of this travel restriction. It will be up to the African Region Certification Commission to see when they can now make this declaration.